Just to start, could you take me through the overall trial results of Reduce It and then how those compared to the results of the Reduce It diabetes study?
Sure. So first, just to recap, what Reduce It consisted of was a bit over 8,000 patients with triglycerides that were either high normal or mildly or moderately elevated with well-controlled LDL cholesterol between 40 and 100, all of whom were on a statin, randomized to icosapent ethyl 4 grams a day or to a placebo and followed for an average of about 5 years, a maximum of 6.2 years. So that's the overall Reduce It trial. What we showed in that overall population was a significant reduction in the primary endpoint of 5-point major adverse cardiovascular events and the key secondary endpoint of cardiovascular death, MI, stroke. The overall primary endpoint showed a 25% relative risk reduction in first events, and that key secondary endpoint showed a 26% reduction in first events. After that first event analysis, also looked at recurrent events, and if you add first and recurrent events, that's total events. So we looked at that, and there was a 31% reduction in the overall trial. So that's the overall trial. What was presented as a late-breaking clinical trial here at the American Diabetes Association was Reduce It Diabetes, and this consisted of the 4,700 plus patients with diabetes from the Reduce It trial, and it's both patients with and without atherosclerosis. What we find in the overall analysis for that diabetes population and Reduce It is a 23% relative risk reduction in the primary endpoint and a 30% reduction in the key secondary endpoint, heart events, cardiovascular death, MI, and stroke. And we also looked at total events in this population, this subgroup of patients with diabetes from Reduce It, and found a 24% reduction in total events, statistically significant. So that's the time the first event and the total events. But I think an interesting way of examining things is to look at the patients with established cardiovascular disease with diabetes, with established cardiovascular disease without diabetes, and look at those patients with diabetes but without established cardiovascular disease. And in terms of statistical interaction terms and so forth, I would say that the benefits were consistent in the three subgroups the way I just mentioned them. But what does seem to be a bit different is the absolute risk reductions in time the first event, where there's about a 4% absolute risk reduction in the patients with diabetes without established cardiovascular disease, about a 6% absolute risk reduction in the primary endpoint in those patients with established cardiovascular disease but without diabetes. And then in the patients with both diabetes and established cardiovascular disease, it's about a 10% absolute risk reduction. Event rates reduced from about 40% to 30%. And if we look at total events, that is now not just the first event, but also the recurrent event, adding them together, total events, in that subgroup I mentioned, for example, patients with established cardiovascular disease with diabetes, they have a very high rate cumulatively of ischemic events. And the reduction is also quite large, a reduction of over 20%. In absolute terms, I'm talking about now, not relative terms, in the event rates over time. So I think this Reduce It Diabetes analysis illustrates, one, that people with diabetes have higher event rates than people without diabetes, as is consistent with the known literature. And two, more importantly, and pertinent from this presentation, is that icosapent ethyl has a large effect on this risk.
All right, thank you for that. And now I just want to touch on that absolute risk reduction for total events seen in that subgroup of patients with established cardiovascular disease and diabetes. Over 20% absolute risk reduction is huge in terms of a patient's day-to-day life. What does it mean for patients when they can manage their disease this much, I guess, more efficiently, thanks to an agent like icosapent ethyl?
Sure, so that over 20% specifically is referring to the subgroup with diabetes and established cardiovascular disease, but more broadly to those with diabetes, if they meet the entry criteria for the Reduce It trial, either with atherosclerosis or without, then I think they could benefit quite significantly from being on icosapent ethyl. So I think the message is to make sure in those patients with diabetes of course, that we're controlling all their risk factors, their LDL cholesterol, their weight, their blood sugars, et cetera, blood pressure, all those things need to be controlled well. But then an additional risk factor we must now consider is, do they have triglycerides that are elevated? And as we showed in REDUCE-IT, even patients in the higher end of normal, that was about 10% of the REDUCE-IT population, and certainly those with mild or modest degrees of triglyceride elevation, the addition of icosapent ethyl to good background therapy further reduces their cardiovascular risk. So I think we've got to go back to paying attention to triglycerides in people with diabetes, also in people without diabetes.